gentlemen, dear colleagues, as we speak, millions of people in Syria, in Mali, in Somalia, in the Democratic Republic of the Congo, and in many other places struggle with the devastating consequences of armed conflict and other situations of violence. Millions more are quietly experiencing a similar fate in lesser-known places such as the Central African Republic. Every day, civilians are bearing the brunt of violence in countries experiencing long-term conflict and instability, for example, in Afghanistan, Iraq, Yemen, and again in many other places. Armed conflict and other situations of violence are affecting the lives and the dignity of countless men, women, and children. Our ambition budget for 2014 is to reach those people and to provide them with a wide range of services, from emergency relief to support for recovery efforts and for their own capacity and capabilities to cope with the humanitarian crisis. We are also aiming at widening our access to particularly vulnerable people such as detainees. You have all the figures, as Sebastian mentioned beforehand, also under your eyes, but let me just briefly say that the budget for 2014 that we are presenting is the highest budget ICRC in 150 years has ever presented at the 1st of January. So this is, in a sense, good news because it underlines our realistic ambition to bring help to people in need, and it's bad news because so much money is needed because of the impact of armed conflict on people. This amount of 1.29 billion Swiss francs or 1.05 billion euros or 1.33 billion US dollars. This amount includes the initial figures of 1 billion and 104 million Swiss francs for the field operations and 191 million Swiss francs for the support of the headquarters here in Geneva. And if I say headquarters, just note that because of the mandate of ICRC, which is not limited to assistance and protection, but is also a mandate in international humanitarian law, is a mandate to reach out to the state parties, given by the state parties, but also to engage state parties with regard to their positions with regard to humanitarian action and humanitarian law. This headquarter budget is not just an administrative budget of the operations, it's a substantive budget which reflects the broad mandate of ICRC as much as the operation. We consider that this is a realistic estimate of the resources required to maintain an array of quality services tailored to the needs in each situation while taking due account of the different security environment in some of the contexts we are operating. In 2014, the 10 biggest operations in terms of budget will be in Syria, Afghanistan, the DRC, Somalia, South Sudan, Iraq, Mali, Israel and the occupied territories, Sudan and Colombia. Budget increases are mostly related to the immense needs on the ground, notably in Syria and neighboring countries, in Mali, the DRC or the Central African Republic. In some countries, budgets are being increased because we have managed to gain more access to people in need, such as in Myanmar, where our assistance to people in violence-prone regions and our visits to detainees have been expanding over the year 2013 and are potentially expanded next year as well. ICRC under this budget will continue to be present in more than 80 countries of the world and to deliver these services which are described in our budget for 2014 with 1,604 mobile staff and 10,813 local staff. If you do a breakdown on types of conflict, 65% of those resources will most likely be spent in non-international armed conflict, 6% in international armed conflict, 18% in what we call other situations of violence, 10% for situations of intercommunal violence, and 1% for urban violence. Syria will remain a top priority for 2014. Winter is coming with no improvement in sight. More death, injuries, and displacements are causing immense suffering and tearing apart families in besieged areas. Many civilians have not had proper access to food, water, medical care, or electricity for more than a year. Despite all our calls to the parties to the conflict to respect people's rights to medical care without any discrimination, we are not seeing any light at the end of the tunnel. Many wounded people are dying because of the lack of medical supplies or because they cannot get to medical facilities to be tested. Medical facilities, ambulances, health personnel, and humanitarian workers are often targeted. Volunteers from our partner, the Syrian Arab Red Crescent, regularly come under attack while attempting to bring aid or to evacuate the wounded. A total of 32 volunteers and staff has lost their lives so far while on duty in the conflict in Syria. Humanitarian aid and ICRC personnel are often denied access outright or allowed only limited access to the hardest hit areas. Last but not least, our effort to visit detained people in Syria have so far remained in vain, but we will not give up. Visiting detainees remains amongst the top priorities for this organization. The Philippines have paid a high price in 2013 with two devastating typhoons that have affected millions of people. The outpouring of generosity in the immediate aftermath of Typhoon Haiyan enabled us to deliver food, water, and health care to people in desperate need. But the needs do not end there, and we are committed to helping affected communities to get back on their feet. Relief activities will continue throughout 2014, in particular in areas where long-lasting armed violence had already weakened the capacity of people to cope with the situation. Let me just mention here why I highlight so much Syria and Philippines. They are examples, I think, for the Syrian conflict, and the impact on the region is almost an emblematic example of what happens in many other places of the world. Almost each and every imaginable fraction and conflict line is unfolding in Syria on almost all levels of political controversy, be they local, national, regional, and global. And this makes out of the Syrian conflict not only in terms of humanitarian needs, but in terms of complexity and emblematic unfolding of what happens in conflict, such an emblematic case. With regard to the Philippines as well, it's in a kind of an emblematic case because we are convinced that increasingly our traditional templates of looking at situations in terms of either armed conflict or natural disaster becomes increasingly in vain. We are increasingly confronted with situations where natural disaster happens in places of high fragility, and places of high fragility are most likely places of conflict. This is the reason why we became active in the Philippines. This is the reason why we had beforehand, before the typhoons and the natural disaster, an operation in the Philippines. We had people present in the country, and this was also the reason why we had an opportunity to scale up and react rapidly once the typhoon hit. And it is in a sense also an emblematic case because it shows that in terms of scale and frequency of humanitarian disasters with which we are challenged, we have increasingly also a need to partner with others. In the case of the Philippines, We are associating to our operations, of course, many efforts of national societies of the Red Cross and Red Crescent movement. We are coordinating ourselves closely with the efforts of the Federation of the Red Cross and Red Crescent Societies, which again is associating around their parts of the Philippines in which they are particularly active, a series of national societies with their capacities. So it is in terms of coordinated response from the Red Cross and Red Crescent movement, one of those issues where I think we can say, as much as we deplore the disaster, we are also somehow proud that we were able to have a much more coherent and coordinated approach within the Red Cross and Red Crescent movement. Syria and the Philippines are not only the only emblematic situations with which we are confronted. I have said it beforehand. In many contexts, ICRC will continue to bring aid to people suffering the effects of situations of violence other than armed conflict, including situations of state repression, intercommunal violence, and armed violence in urban settings. It's not unusual for people in these situations to have to endure arbitrary detention, disappearances, torture, and other forms of ill treatment and sexual violence. Let me just highlight 2 or 3 key issues which you will find in the budget for 2014 as particular focuses of ICRC. First, what we call, and you are probably very much familiar with, is the initiative on healthcare in danger. Let me just highlight once again that 2014 for this initiative will be a crucial moment. We have collected data and information now on a series of representative conflict situations all over the world, and we are looking at the present moment through those data and evidence that we have collected over the past year in order to formulate recommendations to the international community, to partner organizations, to health workers and health services, in order to improve considerably on a global scale the respect of international humanitarian law with regard to health workers and health installation. Addressing the physical and psychological need of victims of rape and other sexual violence is another priority for 2014. Sexual violence persists as a devastating phenomenon with damaging consequences for victims, men, women, boys and girls, as well as their families and whole communities. Additionally, sexual violence remains vastly underreported and underestimated in terms of prevalence and consequences. The humanitarian response in the diverse needs and the victims remain insufficient. We are committed to increase our efforts to address both the causes and effects of sexual violence. Our response will encompass the provision of healthcare, psychological support, and other forms of assistance to those affected, as well as protection, awareness raising, and prevention activities. It is of particular importance that we strengthen our partnership, I mentioned it beforehand in the context of the Philippines, with national Red Cross and Red Crescent societies around the world. People in remote areas where no other organization is able to go, as in parts of the Central African Republic, Somalia, South Sudan, and in northern Nigeria, often rely on the vital aid from the ICRC and its primary partners, the local Red Cross and Red Crescent societies. By working together with their network of experienced volunteers, we will better understand the situation on the ground and enhance our ability to address humanitarian needs, in particular when they are unexpected or in very secluded places. Let me here again illustrate a little bit on what we have done, for instance, in the past 2-3 years in the context of Syria, where we have partnered with the Syrian Arab Red Crescent, but at the same time invested a lot in capacity building and training for neutral, impartial, and independent humanitarian action. If today in Syria the international community can do what it does, it's also largely because of our long-term investment into the capacities and capabilities of the Syrian Arab Red Crescent, which takes the brunt on bringing aid to people, which is the key local and national interface which is used by the United Nations, by many other NGOs, and is our first and foremost partner, of course, as well. Let me also finally say that we are determined to bring aid to people who need it most wherever they may be, and in that sense, access and security will be a key issue on our operations in 2014. Reaching victims on all sides of an armed conflict or other violent situations to provide impartial aid requires acceptance and trust. We have to keep working for it each and every day. And let me just here, as I am speaking to the press, also commend all my colleagues in the field who tirelessly each and every day are painfully negotiating access and security arrangements. In many parts of the world in 2013, we have been able, because of their engagement, to enlarge our surface of operation and to service more people than that we would have hoped at the beginning of the year. In many contexts, including Syria, Afghanistan, Somalia, the DRC, Mali, we have, compared to the 1st of January and our expectation in 2013, been able to enlarge our activities, be it in terms of food and nutrition, be it in terms of water and sanitation, or in terms of medical aid and assistance. Having said that, one of the recurring features which troubles and concerns us is that very often, while we have been able to negotiate skillfully access and security arrangements, the needs are accelerating even more, and therefore the gap between increasing and exponentially increasing needs and linear expansion of our activities leads to a result where the gap between what we can do and what we should be able to do is in many places of the world increasingly substantive. So let me conclude with those few remarks which hopefully give you a little bit of a template to see where we are and where we are headed to in 2014. But of course, the devil is in the detail in many senses, and many of the details are in the documentation to which Sebastian alluded to at the beginning, and I'm more than happy, together with Regis, to respond to your question. Thanks a lot.
Thank you very much, Peter. So we will take some questions. If you can, as always, introduce yourself briefly and then maybe speak in the microphone so that people following us online can hear your questions as well, please. So,
Ilya
yes.
Dmitrichev from Russian news agency TASS. You mentioned that it's the highest annual budget for ICRC in last 50 years.
150 years.
150 years. So that in history, no?
In our history, yes.
Mm-hmm. Okay,
yeah.
that was my thing.
Okay. Please, microphone is there.
Reuters, Stephanie Nebahay. I'm very surprised to not hear you make any reference to your 3 detained colleagues in Syria. Can you finally tell us, can you confirm to us that they're all Syrian? Can you tell us whether you've had any contact with the abductors, bearing in mind that the other 4 were released? We understand that 2 of them at least are drivers. Can you say anything about them?
No, with your indulgence, I think we are putting all our efforts to get them free, and we focus on these efforts, and we do not further communicate on the 3 we have confirmed, and I can confirm that the 3 are still taken hostage, and we are working on the issue.
Imogen? Please.
Imogen, folks, BBC. You said at the beginning that with Syria you don't see any light at the end of the tunnel. So I'm just wondering, you don't have so much optimism for Geneva 2 next month? And follow up to that, how can you just give us a picture of your access in Syria at the moment?
Well, maybe I start with the second question, which illustrates maybe the judgment on light and the tunnel. I think what we see in Syria, to give you a differentiated picture, is that we have been, as I mentioned beforehand in a more general statement, we have been able to expand considerably our humanitarian operations in terms of food, water and sanitation. Over the past 3 to 4 months, we have gone from 200,000 figures to 500,000 plus figures per month as recipients. And also in terms of recipients for water, their figures are a little bit more difficult to somehow capture, because we are not bringing individual cups of water to people as in food and household items. But I think we are very confident that in many places in Syria, including fighting areas, opposition-controlled areas, as government-controlled areas, we have been able to repair water systems and to have millions of Syrians taking advantage from our expanding water and sanitation work. Where we haven't been particularly successful is in increasing our medical activities in Syria, which remain below our expectations, because we have on both sides, we are struggling with the argument that whatever medical aid is brought to one part or the other is interpreted as an indirect support, military support to the other side. So this is the line of argument with which we are confronted, and with which is most of the time a big obstacle in developing operations. So this was a sector approach on where we stand on humanitarian assistance. If I take a geographic approach, what we can say is that it is the most difficult part of Syria are the sort of those territories where populations are trapped in between fronts. It's the region of Syria where the most of the fighting is taking place. Basically, the whole band from Aleppo to the southern border, and into Deir ez-Zor towards the Iraqis. So the sort of T where the two sides are locked into each other, where populations are trapped, access is the most difficult. And as I mentioned, in those areas we had only very fragmental and incidental successes in negotiating cross-line deliveries, and many of the villages and cities in these areas haven't seen humanitarian assistance in months. And so this is in terms of sector, it's medical. In terms of geography, it's the combat zones from Aleppo to the south and Deir ez-Zor, which are those which suffer from the biggest restrictions to access. And we haven't been able in those critical areas to expand considerably our operations, although we have, as many other organizations, also from time to time been able to negotiate a convoy here or a convoy there. But this didn't change the dynamics in terms of the sort of quality spread of humanitarian assistance in Syria. And in that sense, this is a situation which is now preoccupying us for months, and which hasn't changed dramatically for months, despite the efforts we have made, and despite accidental concessions from the one side or the other in terms of access or security assurances. So the light at the end of the light at the end of the tunnel is basically to be seen in that context. We haven't seen materializing any substantive progress. I do not express myself towards any expectation with regard to Geneva II, because this is clearly not the president of ICRC's function. Geneva II is the political process my dear friend and colleague Brahimi is working on, and as a humanitarian I can only wish that there is success, but I don't have any expectations or views with regard to Geneva II.
Thank you. Yes, please.
Yes, first thing is, did you say that you have expanded your operations in terms of food, water and sanitation in the last 3 to 4 months to 200,000 to 500,000 people? That's correct?
Yeah.
Okay.
Yeah, well, plus
well,
minus.
more or yes.
Yeah.
And in terms of your work to visit detainees, have you been? You said that you have not haven't found any progress on this issue, but so this means that you have not been able to visit any people that who is detained by the government forces or the opposition forces. Anybody? Or
Yeah, you're right in your assumption or question. We haven't been able since we were in the the last visit was the prison of Aleppo.
Yes, we did 2 visits, like I think 2 years ago, and since then, yeah, that was at the very beginning of the crisis, and since then we haven't been able to visit detainees.
Neither on the one side nor the other side.
Okay. Yes, sir, please.
Lionel Faton, Japanese news agency, Kyoto. I'd like to have your view on the situation, the evolution of the situation in Central African Republic, and how you're planning to address the growing crisis. Thank you.
Well, you may have followed that we have been almost continuously present in the Central African Republic with some repositioning of our forces at a certain moment, but we are basically back in the country, not only in Bangui but also in other parts of the country, focusing on medical assistance first and foremost, and supporting the national societies in some other efforts. We are encouraged over the past couple of weeks that finally there is more recognition in the international community that the situation is increasingly dramatic. You will see in the budget for next year that is the single most important increase in a program that we have provided for in our budget for 2014 in terms of percentage rise, and this reflects, as always with our figures, a sort of a conservative estimation between what would be needed and what we most likely are hopefully been able to deliver. So it's a 67% increase, if I remember well, compared to the budget of 2013. And this reflects a little bit our assessment also that we are in an increasingly dramatic humanitarian situation, which of course is again one of the unresolved also political problems we are confronted. Regis, further details on?
I think I have to say that on the Central African Republic, as an organization, because as mentioned by our president, I think we managed to keep a presence in Central African Republic throughout the crisis. So we have responded, first responder in the domain of health, but also many interventions in terms of protection. I see many messages passed to all the groups and all the stakeholders, reminding them about their obligation when fighting. And as you might probably have read, this morning there were again attacks and clashes in Bangui. Our teams are on the spot. Together with also MSF, for example, we are trying to answer as rapidly as possible to the health needs that will arise from the situation. And again, for us, clearly a priority in terms of expanding our operations. And we are proposing in our budget for 2014, for example, to have a full-fledged hospital support in areas which are outside Bangui, because this is also one of the problems. We have to deal there with a huge range of different stakeholders. There are very big security constraints. Our teams have suffered a lot of that. There's a lot of criminality around Bangui also. I think we have lost, as an example, it was more than 15 vehicles that have been taken by different groups since the beginning of the year. So we work and we push the limit on a daily basis, but this is typically the situation where we feel it extremely necessary, because you are surrounded by needs. This is a real humanitarian catastrophe there that we are faced with. And again, this is probably the most spectacular example of a forgotten crisis. It has come now back on the agenda lately with a few council resolutions and others. I think it's more than necessary, and it's more than necessary that the humanitarian response is becoming broader and stronger.
Yes, sir, please, and then you. Yeah, go ahead.
Jean-Philippe Scheller, Swiss Television. Reading your last statement in the international ICRC review, you adopted a hardline position towards Israel's occupation policy. What did change in this Israeli policy that brought you to this position?
Well, you may have, just first for the context, you may have seen that the article in the International Review is basically the print of a conference I have had beginning of July during my visit to Israel at Hebrew University in Jerusalem, where Judge Baker and myself gave our views on the situation in the Middle East. Everybody knows, and it's public knowledge, that some of the critical stumbling blocks in the Israeli-Palestinian relationship is Jerusalem, the wall, the occupied territories. And I have articulated in that article a view under international humanitarian law how to look at those issues. I think you have seen also that I have recognized in the speech I have made that the three issues are issues which are at the same time political and humanitarian. And in that sense, it's the article does not reflect any fundamental change from what ICRC has always said and maintained in its conversation. And it's also not really big news to the world in a sense that those are the three issues which are debated within Israel, within the region and beyond. And so you just see in the review the position of ICRC, which I think is expressed clearly with regard to international humanitarian law and the three key issues.
Okay. So, yes, please.
Simon Petit, Le Temps. Je me réfère au budget pour le siège. Alors, Alors, est-ce que c'est un budget des 191,7 millions? Est-ce que c'est un budget en hausse? Et est-ce que ça inclut de nouvelles mesures de délocalisation de certains services administratifs?
Nous avons, comme vous le savez, n'est-ce pas, nous avons pris certaines décisions plus avant dans l'année, n'est-ce pas, en automne, de délocaliser certains services administratifs et de faire des mesures d'économie dans certains domaines du siège ici à Genève. Moi, j'ai toujours été très clair que les mesures d'économie et les mesures de renforcement de Genève et du centre à Genève vont ensemble. Ce n'est pas une logique de délocalisation, mais c'est une logique de pouvoir profiter de l'économie d'échelle et de réflexion où certains services sont le mieux localisés à l'intérieur d'une organisation qui est présente dans plus de 80 pays. Ce que vous voyez reflété ici, c'est donc une double dynamique d'efforts d'économie et de délocalisation tels qu'on les a annoncés et qu'on va les mettre en œuvre dans les années à venir, en même temps qu'une logique de renforcement du CICR ici à Genève et de notre capacité d'interagir, de réfléchir, de contribuer sur la place de Genève, n'est-ce pas, au développement des idées humanitaires, de la politique humanitaire, de coopérer avec les autres agences. Donc vous avez un double mouvement et la hausse du budget reflète notre effort de renforcer Genève et la qualité du centre et ici à Genève en même temps que les efforts d'économie.
Okay. You had a question, yes, please.
Agnès Pedrero, Agence France Presse. Pour les délocalisations, est-ce que vous pouvez donner le chiffre de ces délocalisations pour ces prochaines années? Et puis l'autre question que j'avais, c'était par rapport au budget donc pour 2013 de l'an passé, à quelle hauteur il a été financé? Est-ce que vous avez des difficultés comme l'ONU pour financer vos besoins?
Écoutez, si vous voulez les chiffres très précis, on va vous les donner. Financièrement, c'est à peu près dans les 4 millions par année sur 4 ans. À point de vue poste, je ne peux pas vous dire exactement ce qui est en 2014 et 2015, mais on va vous donner les chiffres précis. Donc c'est mais l'ordre de grandeur est dans les 15-16 millions sur 4 années. Sur le budget, peut-être une occasion pour vous rappeler que la méthodologie budgétaire du CICR se différencie et se distingue considérablement de la méthodologie budgétaire des Nations Unies. Nous orientons notre budget, bien sûr, aux besoins, mais nous présentons aux donateurs un budget qui miroite notre estimation sur les capacités de mise en œuvre. Et donc cela fait que nos budgets sont toujours considérablement plus inférieurs au budget présenté par les Nations Unies sur certains conflits, parce que les Nations Unies présentent les besoins tels qu'ils les estiment et extrapolent sans considération de leur capacité de mise en œuvre. Et donc, par la logique, ou par les logiques de ces deux logiques budgétaires, on arrive à des chiffres de mise en œuvre très différentes et et de remplissement très différents des donateurs de ces appels. Nous avons normalement des chiffres de mise en œuvre dans les 90 à 95%. Dans l'échelle, je ne peux pas vous dire maintenant parce qu'on n'a pas encore terminé l'année, mais c'est dans cet ordre de grandeur. Alors que l'ONU a des appels qui sont beaucoup plus élevés, mais en même temps aussi des financements beaucoup plus réduits, point de vue pourcentage de financement du budget. Donc, ces deux manières. Ce que je peux vous dire, c'est que j'ai présenté les appels hier aux États ici présents, qu'on a tous invités au CICR pour une discussion et une présentation comme je l'ai fait aujourd'hui avec vous. Ce que je peux dire, c'est que j'ai l'impression que les États apprécient que le CICR présente un budget qui est un budget réaliste et donc qui leur donne une certaine assurance qu'un financement du CICR aura de très très grandes chances d'être mis en œuvre et donc de produire des résultats.
Any more questions? Stephanie, yes.
About the areas where you've not had access in Syria, can you sort of define some of the besieged areas that you presumably have concerns about? Mauritania or others?
Well, as I mentioned to you beforehand, I mean, it goes really from Aleppo to Homs, the old city of Homs, to the whole strait from Aleppo to the southern border is one with very limited access, and you can almost take each and every city in that region which is somehow trapped in between front, which is a region of little or no access over the past month. There are also regions in opposition-controlled areas which are difficult to reach, and which we have also a relatively clear picture where we should be and we are not. But I think, I don't know, Regis, whether you want to go in further details.
No, I think you're close to say it all. I think you have to understand this is exactly what was said at the beginning. It's a continuous struggle to negotiate access on a daily basis. We are pushing the limits on a daily basis, and we have still achieved 120 cross lines since the beginning of the year, which is just exceptional if you see how many times we are able with teams of mobile expatriates to go into opposition-held areas. Now there we remain with these pockets, and you mentioned them all at the eastern Ghouta of this world and others, where we definitely never got access, despite all the negotiations we have put into, and all the efforts we have put into that. But we will continue, and as mentioned, broadly speaking, we managed to deliver to more people in Syria than was the case a few months back.
Okay, so if there are no more questions, maybe we can close it here. Thank you again very much for your interest. We remain at your disposal should you have more questions on our priorities and operations for next year. And again, a lot more information is on our website, icrc.org. Thank you very much and have a good end of the day.
Merci. Okay.